Vanessa, a 40-day-old baby, was too young to receive the vaccination for pertussis. What had initially appeared to be a normal cough and cold turned into moments where she stopped breathing. After she stopped breathing long enough to turn blue, Vanessa's parents took her to an emergency room. She was too small for the standard ER, so she was taken to a special children's hospital. The pediatrician there knew right away that she had a highly contagious bacterial infection, commonly known as whooping cough. Vanessa spent 5 days in the ICU. The vaccination for pertussis is what could have prevented whooping cough. Since Vanessa was too young, she had to rely on herd immunity. Herd immunity is defined by the CDC as a sufficient proportion of a population is immune to an infectious disease through either vaccination or prior illness, to make it spread from person to person unlikely. Individuals not vaccinated, such as newborns and those with chronic illnesses, are offered some type of protection because the disease has little opportunity to spread within the community. In Vanessa's case, somebody in the community did not vaccinate. Later, it was discovered that someone in her brother's high school had a case of whooping cough. According to the World Health Organization and UNICEF, immunization estimates 1 in 10 infants did not receive any vaccinations in 2016. This put them at serious risk of potentially fatal diseases. The percentage of children who receive their full course of routine immunizations has stopped climbing and remains at 86% since 2010. The global immunization coverage target is 90%, and we are at a worldwide standstill. 2 to 3 million deaths are prevented each year from immunizations. The World Health Organization has declared it to be one of the most successful and cost-effective public health interventions. Although anti-vaxxers have been around as long as vaccinations themselves, have had a recent resurgence that has placed the attainment of the 90% goal in jeopardy. Why are vaccinations needed? There are many reasons. One for each person in the world. In 1964, an epidemic of rubella, also known as German measles, infected over 12 million Americans. In total, 2,000 babies died and 11,000 miscarriages were had. Since 2012, there have only been 15 reported cases to the CDC. Although diseases have lessened due to vaccinations, they are not all gone, with one exception. Smallpox has been eradicated. Even polio still exists in the world today. America has a high vaccination rate, but those who are not vaccinated are still able to get sick when exposed. If more people stopped getting vaccinated, the diseases would make a comeback. For example, in Japan in 1974, there were less than 400 cases of whooping cough and no deaths. The vaccination rate at that time was 80%. Within 5 years, that rate dropped down to 10%. And in 1979, there were 13,000 cases and 41 deaths. So how do vaccinations work? The following excerpts from the CDC gives a great overview. To understand how vaccines work, it is helpful to first look at how the body fights illness. When germs, such as bacteria or viruses, invade the body, they attack and multiply. This invasion is called an infection, and the infection is what causes illness. The immune system uses several tools to fight infection. Blood contains red blood cells for carrying oxygen to tissues and organs, and white blood cells or immune cells for fighting infection. Blood contains red blood cells for carrying, for fighting infection. These white cells consist primarily of B lymphocytes, T lymphocytes, and macrophages. Vaccines help develop immunity by imitating an infection. This type of infection, however, does not cause illness, but it does cause the immune system to produce T lymphocytes and antibodies. Sometimes, after getting a vaccine, the imitation infection can cause minor symptoms, such as a fever. Such minor symptoms are normal and should be expected as the body builds immunity. There are many anti-vaxxers that fear the safety of vaccinations, and some believe they cause illness. The side effects of vaccinations do exist, but as stated by the CDC, they are generally minor and normal. The FDA, the Food and Drug Administration, works with the PHS, which is the Public Health Service, and the American Academy of Pediatrics, also known as the AAP, to keep vaccines as safe as possible. For example, Thimerosal, which is a mercury-containing agent. It is a compound that prevents the growth of dangerous bacteria and fungus, and it was removed from childhood vaccinations in 1999. This was done purely as a precaution and not due to any side effects or illnesses. The reason for its use is to prevent the growth of bacteria in multi-use vials. Now, for childhood vaccinations, the vials are individual. For flu, however, those are still given oftentimes in a multi-dose vial, and the Thimerosal is still used today. In addition to the efforts of the FDA, the PHS, and the AAP, there is also a vaccine adverse event reporting system known as VAERS. VAERS is a national vaccine safety surveillance program that is monitored by the CDC and the FDA. Reports of any adverse events that happen after a vaccination are collected and analyzed. There are approximately 30,000 reports every year. Most that are reported are known side effects, such as fever. Finally, that information leads to the development of vaccine information statements. Those are information sheets from the CDC which explain both the benefits and the risks of each vaccine. And it is federally required to be given out before every vaccine, including booster shots or follow-ups. The resurgence of the anti-vaxxers in modern times can be traced back to a case series that was published by The Lancet in 1998. In the paper, Dr. Andrew Wakefield and 12 colleagues suggested that the MMR vaccine may be linked to autism. As soon as it was published, other studies were conducted and published that refuted Dr. Wakefield's report. And eventually, 10 out of the 12 co-authors retracted the original paper, admitting that their data was not sufficient. In addition, it was also admitted that Dr. Wakefield did not disclose his financial interest. He was actually being funded for his paper by lawyers who were suing vaccine makers. The Lancet did a full retraction in 1990, although it was only a small paragraph within the journal. At that time, all of the authors of the paper were found guilty of both ethical violations and scientific misrepresentation. Later, they were also found guilty of deliberate fraud as they picked and chose the data that suited them and falsified facts. It appears that the fraud was committed strictly for financial gain. Unfortunately, the damage from the paper remains relevant today despite all of the evidence that disproves Dr. Wakefield's paper. The bottom line is that vaccines do not cause autism. The Academy of Family Physicians, the American Academy of Pediatrics, and the CDC recommend a schedule of vaccinations throughout a person's life. For 2017, the recommended immunizations for ages birth to 6 years old are as follows. At birth, a child should have the Hep B vaccine. At 2 months, the rotavirus, the DTaP, the Hib, which is for influenza B, the PCV, which is a pneumococcal vaccine, and the IPV, which is for polio. At 4 months, they need to have a booster of all of the same shots. At 6 months, they need the rotavirus, the DTaP, the Hib, and the PCV. Between the ages of 4 and 6, again, should have a DTaP, an IPV, and now add the MMR and varicella. And annually, everyone should have a flu shot. For the ages 7 to 18, the shot schedule is as follows. Between 11 and 12, they need to have a meningitis vaccination, a Tdap, and can also start the HPV. Now, when the HPV shot, the human papilloma virus, first came out, it was initially for only girls. However, it has been proven to work for boys as well, and both male and female should start getting the HPV shot at 11 to 12. At 16 years, they again should have a meningitis, and again annually a flu shot. For adults, a flu shot every year, a TD booster every 10 years, an MMR, and a varicella. Patients are understandably bothered by the discomfort of a shot for their children. The CDC, along with the AAFP and the American Academy of Pediatrics, have developed a tip sheet for a less stressful shot visit, which I happen to have here. So some of the tips are, before getting the shot, come prepared. Take these particular steps before your child gets a shot to help make the immunization visit less stressful for both of you. Read any vaccine materials received from your child's healthcare professional and write down any questions that you may have. Find your child's personal immunization record and bring it to your appointment. An up-to-date record tells your doctor exactly what shots your child has already received. Now, the state of Michigan does hold a record as well. However, it can be difficult to access that information, especially for an individual person. A physician's office can access it a little more readily, but having your own personal immunization record is going to save everyone a lot of time. Pick a favorite toy or book and a blanket that your child uses regularly to comfort your child. And for older children, be honest. Explain that shots can pinch or sting, but that it won't hurt for long. Also, engage other family members, especially older siblings, to support your child. Avoid telling scary stories or making threats about shots. As far as the being honest with your child, I do have to advise that the HPV shot for older children, not only is there a pinch from the needle, but that is actually one of the more aggravating serums. It does burn a little bit longer, and it is a series of 3 shots. So I do recommend being forthright about this information when going to do it. While you're at the doctor's office, if you have questions about immunizations, ask your child's doctor or nurse. Before you leave the appointment, ask your child's doctor for advice on using non-aspirin pain reliever and other steps you can take at home to comfort your child. Try these ideas for making shots easier on your child. Distract and comfort your child by cuddling, singing, or talking softly. Smile and make eye contact with your child. Let your child know that everything is okay. Comfort that child with a book or a toy. A blanket that smells familiar will also help. And hold your child firmly on your lap whenever possible. For very small children or infants, other ways to soothe your baby: swaddling, skin-to-skin contact, and offering a sweet beverage like juice. But please wait until they're 6 months or older for that. For older children, take deep breaths with your child to help blow out the pain. Point out interesting things in the room to help create distractions. Tell or read stories. Support your child if he or she cries. Never scold the child for not being brave. Once your child has received all of the shots, be especially supportive. Hold or cuddle, and for infants, breastfeed or offer a bottle. A soothing voice combined with praise and hugs will help reassure your child that everything is okay. After the shots, sometimes children experience mild reactions from vaccines, such as pain at the injection site, small rash at the injection site, or a fever. These reactions are completely normal and will go away on their own. The following tips will help you identify and minimize those mild side effects. Review any information that your doctor gives you about the shots, especially the vaccine information statements, or other sheets that outline which side effects might be expected. Use a cool, wet cloth to reduce redness, soreness, and swelling in the place that the shot was given. Reduce any fever with a cool sponge bath. If your doctor approves, give non-aspirin pain reliever. Give your child lots of liquids. It is normal for some children to eat less during the first 24 hours after getting a vaccine. And pay extra attention to your child for a few days. If you see anything that concerns you, call your doctor. That's what is recommended for a less stressful shot visit. So these tips from the CDC can help soothe your child on that next shot visit. If you or your child are missing any vaccinations, make your appointment today. Doing so will help the world reach that goal of 90% vaccination rate. Thank you.